Hi there. Administering medications to kids isn't just about giving smaller doses of adult meds. Children's bodies are unique and constantly developing, which means how they handle medications is also different. Let's dive into the essentials of pediatric pharmacology and age-specific considerations you need to keep in mind. First off, absorption. In neonates and infants, their gastrointestinal, GI tracts are still immature. This affects how drugs are absorbed. For instance, the higher gastric pH in neonates can make acid-labeled drugs like penicillin absorb better, while weakly acidic drugs like phenobarbital might not get absorbed effectively. And because their skin is thinner, topical medications can be absorbed more quickly, leading to higher systemic levels and potential side effects. So when considering something like a topical steroid cream for a neonate, be cautious of systemic effects like growth suppression. Next, distribution. Neonates have a higher percentage of body water and lower body fat. For water-soluble drugs like gentamicin, this means they might need a higher initial dose to reach therapeutic levels. Additionally, reduced plasma protein binding in neonates increases the free fraction of drugs like phenytoin, which can lead to toxicity if not monitored closely. On to metabolism. At birth, liver enzyme activity is not fully developed, so drugs metabolized by the liver, like morphine, may have prolonged effects in neonates. As children grow, their liver enzyme activity often exceeds that of adults, which means they metabolize drugs faster. For example, older infants and children might need higher or more frequent doses of drugs like theophylline. Now, excretion. Renal function is immature at birth, affecting how drugs are excreted. Drugs like gentamicin, which rely on renal excretion, might accumulate in neonates, requiring dose adjustments and careful monitoring. As children grow, their renal function matures, and drug clearance increases, needing adjustments in dosing. When it comes to dosing considerations, it's often weight-based or based on body surface area, BSA. For instance, a child weighing 10 kilograms might be prescribed 15 milligrams per kilogram of ibuprofen for fever, resulting in a 150 milligrams dose, quite different from an adult's dose. And for younger children who can't swallow pills, liquid formulations are essential. Liquid antibiotics like amoxicillin are adjusted based on the child's age and weight, with flavors added to make them more palatable. Lastly, safety considerations. Medication errors are a higher risk in children due to the need for accurate weight-based dosing and off-label medication use. A miscalculation with a drug like digoxin, which has a narrow therapeutic index, can be serious. Children also experience different adverse drug reactions, ADRs, compared to adults. For instance, tetracyclines are usually avoided in kids under 8 due to risks of permanent teeth discoloration and impact on bone growth. In conclusion, understanding the unique aspects of pediatric pharmacology is crucial for safe and effective medication administration. Always be vigilant in dosing calculations, monitor for adverse effects, and select appropriate formulations to optimize therapeutic outcomes for your pediatric patients. Thanks for watching. If you found this useful, don't forget to like and subscribe for more healthcare.